Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. Thank you for joining us today for part one of a five-part series called Platicas, Latino Wellbeing During COVID-19. NALBA is a nonprofit agency dedicated to the well-being of Latino families and communities across the United States. Our mission is to address the disparities affecting the behavioral health of Latinos. Today, we're excited to kick off the first of five-part series on how Latinos and their families can and do take care of their emotional, physical, and spiritual well-being during COVID-19. I'd like to thank the Conalma Health Foundation for helping make this series possible. Each month through November, NALBA will be hosting a professional expert in public health, behavioral health, or the field of medicine to share their insights, advice, and tips on taking care of yourself, your family, and your community during the COVID-19 pandemic, and then what additional resources are available to help. So let's begin and let's welcome our first presenter, Dr. Susie Villalobos, who I have had the pleasure of knowing for at least 12 years, and whose work in the Paso del Norte region along the US, New Mexico, and Mexico border includes prevention and research. Dr. Villalobos, welcome. It's good to have you with us today. Please
Thank you,
introduce
sir.
yourself. So go ahead and introduce yourself to the Facebook audience.
Yes, thank you, Fred. Thank you for having me here today. Just a little bit about my experience. I've been working in public health for the past 20 years. I've worked with mental health professionals, both in academic and nonprofit settings. Currently, I'm a research director for a university that's working alongside a medical center in El Paso, Texas. And I'm so glad to be having this conversation with you today, as I feel that the mental health aspect of COVID-19, particularly with Latino communities, is an important one to have. Many times the stigma of mental health is difficult to discuss, and still during my lifetime that has not lessened for our Latino communities. I think the ability to share our stories is an important one for our audience, particularly our NALBA audience, and I thank NALBA for having an open forum such as this, which allows for individuals to ask questions in a familiar setting.
Well, thank you, Susie. It's going to be great to have you here. So let's get started and let's tell folks how the Platica will work. So you and I are going to have an open conversation, and more importantly, our Facebook audience will get to ask questions as well. So as questions come up on the screen, I'll be asking Victor to put those up on my screen so I can actually see them. And then we're going to be asking you questions that come from the Facebook audience. I've got a series of questions, of course, myself. So are we ready to get started?
Well, let's go. I'm ready.
Great. Excellent. Well, Dr. Villalobos, how would you define emotional health?
I think emotional health is really our ability to cope with everyday life, and it reflects how we think and feel about ourselves. For me personally, this means like getting up every morning and having a sense of purposeful activities. I think during this COVID time, it's been really uncertain day to day what is going to happen in our daily lives. And I think having a check-in with ourselves, a mental health check-in, and being able to tend to those necessary things that we need, like sleep, having a sleep hygiene, our diet, making sure that we incorporate fruits and vegetables, and incorporating maybe 30 minutes of exercise. Now, I know a lot of the gyms have been closed, particularly in our area. They were closed and they were open, and I think they're closed again. But I think it's easy to take a walk, or maybe to incorporate watching a YouTube video to do some exercise at home. And that's something that could also be like a family activity. You can incorporate your kids into something such as those activities. But yeah, overall, I think it's just our ability to cope what's coming each day.
Thanks, Susie. So tell me a little bit. So we're experiencing something that's the first time we've ever experienced a pandemic for many of us. And that's such a unique set of circumstances. It has an impact on us. And so we're trying to learn how to manage and cope with all of that. So what are some of the things that you're hearing about how families, particularly Latino families, are dealing and coping with their current circumstances?
Well, you know, Latino families, the family is the core. It's the unit that runs the Latino culture. And I think it's a group mentality, and the preventive measures that we can take. Some of the things that I tell my son, I have a young son and he's 8 years old. And I look at it as the 4 Ws, where you wear your mask, you wash your hands, you watch your distance, not social distancing, and we'll talk a little bit more about that. And you watch your symptoms for yourself and watch symptoms for other family members. And I say that because in Latino families, sometimes we have more than one generation living in the household. We have parents who are working, who are most likely essential workers. We have kids, young kids. We may also have high school students that have missed out on some of their graduation activities. We have younger kids that have missed out on birthdays. And then we have our elderly who normally will not leave the house. So I think it's important as a family to plan and to talk and to see where the preventive measures lie within each of those groups.
Well, given all of that, Susie, help me kind of learn a little bit about what's unique for Latino communities and families about how they generally cope with worry and stress.
Well, you know, anxiety, stress, and worry is it's a normal physiological response. But during this pandemic, during COVID, it has been at an extreme level. And some of our mental health is being tapped. And I think for Latino families, it's hard for us to really share with outside sources what our worry and stress is. So we reach out to our family, we reach out to our friends, and some of us really reach out to the church as well. I think our faith is important in the Latino culture. I think knowing, you know, same attracts same, being able to rely on the church, not only to put upon the burdens to the church, but also let them know, you know, in celebrating life and their happiness, and maybe also to understand that the family is going through some burdens as well.
Well, that's a really excellent point. So when we think about the cultural aspects of how we manage our life circumstances, right, on any given day, now we're faced with some new challenges, right? Folks who might be feeling isolated, they don't get to see their kids, they don't get to give the grandkids los abrazos y los besos, you know, and so that changes how we react these days. And so somehow faith, particularly our spiritual well-being, is very important to Latinos. And so what are some of the kinds of things that people typically do to help really manage the circumstances they're in because of how they turn to their faith?
So I think some of our elderly who are not able to go to church as they normally did may be able to do a turnaround and watch I know my mom personally watches her sermon on her iPad, and she sometimes watches it on her phone. So she still feels that connection to her church. I also think that reaching out, particularly, I don't like the word social distancing. I think it's more of learning physical distancing, because by human nature, we still need to be very social, particularly in the Latino culture. I don't think self-isolation is a good word. I think that taps into more of the mental health issues that we might experience with isolation. So that's why I always like to say it's more of a physical distancing. But yes, sharing with your priest, and also sometimes just like I mentioned, a self-check-in. If you need to talk to somebody, I think it's important that Latinos understand that there are other resources as well as the church to help identify where they need assistance. And that's the hardest part for Latinos, I feel. Statistics show that Latinos, I think 1 in 10 reach out for mental health services, and they're in dire need of those right now.
Sure. And of course, the thing about mental health services is there are circumstances that are just situational. These are common occurrences. So, which is very different than, let's say, mental disorders or mental illnesses, right?
Correct.
So talking
Yes.
about just daily experiences, which is really important here, because what we're trying to recognize is that Latinos obviously have been managing and coping with very difficult circumstances throughout their whole life, right? So it's not as if though this is going to somehow be extraordinarily different. But the question is, so how have families managed to cope with difficult situations from what you've done professionally and what you've learned in your prevention work?
Well, you know what? Latino culture has a resiliency. They have a true grit. And I've seen families really carry the torch for the preventive measures, particularly when it comes to situations of stress and anxiety. I think they share the same common goal in protecting the family. That's the ultimate goal, is protecting the family, and whatever that entails, whether it's economically, whether it's health-wise, whatever the danger lies, the fear of contracting the virus. I think it's important to understand that as a Latino family, has to be a plan in place. There's always room for improvement when it comes to a plan, particularly in these unprecedented times.
Sure, that's right. What about the role of moms? If you think about how significant women are in our families, and all of us love our moms and our sisters and our grandmas and our tias, and the list goes on, right? They
Yes.
are very significant to what we're experiencing now. So talk a little bit about that. And then the one part I want you to think about particularly is how can women take care of themselves given the current circumstances too. So it's not just
Yeah.
about the kids, the rest of the family, but about themselves.
Yeah, and that's, I'm glad you asked me that, because I'm a single mom, and I have a mom too that I worry about during this COVID. And I'm sure that there's other families that worry about their grandmothers as well. Moms are taking on a really humongous burden right now, because not only are some still working, they're still working and coming home and trying to leave some of that stress at work, and still do what they need to do as a Latina mom, which is cook the meals, keep the family together, make certain that the grandparents are still okay, checking in with everyone else before that they check in with themselves. And talking with a couple of my colleagues and my friends and family, I tell them a lot of the times to do a self check-in, even if it's in your car before you step into the house. It's important that you take 3 deep breaths and realize that you're switching gears from your job to your home. And I think that's important because it shifts the focus, and you don't want to be anxious and you don't want to be stressed walking into the home and carrying that on to other activities. And as far as for a mom to self-care for herself, I think it's important, some of the things that I mentioned, to have like a sleep hygiene, to make sure that you go to sleep at a certain time, that you wake up still at a certain time, that you're still eating properly, not just tending to everyone else's meals. That you do things for yourself, maybe some yoga, maybe taking a walk for yourself. A lot of this social media stuff, we have Netflix. I mean, watch a video for yourself. One thing that I've been doing that I've enjoyed that I was not doing before COVID was listening to podcasts. And podcasts are really neat because they're recorded, or they could be live as well. But a lot of our shows have not, they don't have any new episodes. So a lot of the stars that are in these TV shows are doing these podcasts, and they're talking about, other issues besides the show. And it's kind of neat to hear a familiar voice, because you watch this show on a weekly or monthly basis, and yet they're talking about something, that you could listen to. You don't have to interject, and it just takes you away from the day-to-day issues that are going on, particularly with COVID.
Right. So let's say you haven't seen grandma for at least a couple of months. So what are the ways that families are still connecting with their grandparents or with their parents, right? So we may not be able to be physically in immediate proximity, right? For lots of
Yes.
reasons, right? So how are we filling in the space, right? In other words, we just haven't completely stopped communicating. So what are the things that we're doing to fill in those spaces, right? Because how are we communicating with our grandparents, and what are the methods that we're using to do that, right? Because we haven't stopped, talking to our grandparents, right? The point being is,
No.
but what are we doing?
Yeah, I think the thing for me is when we first started back in March, everybody was still unsure what that meant, social distancing. So I think for me, the physical distancing was important, understanding the wearing of the mask and how the virus was contracted. So using social media, using something like a platform that you and I are having a conversation, you can FaceTime now on your phone, you can FaceTime on your iPad. It's important though that we find a way to teach our grandparents, because they may not be familiar with the technology that we're using now. So it's a very different venue for them to be talking on an iPad or a phone, not knowing, you know, oh, am I supposed to be looking here, listening here? I'm lucky because my parents are very well versed in technology, so I'm able to do that with them. But our grandparents, that might be a different story. It might take a little bit of time, but I think it's worth the effort. And also, we can still pick up the phone and call each other. I think it's important to still do check-ins. I mean, it's even more important if we have seniors who are living alone. You need to do just a call. And I highly recommend anybody who's listening right now, just today, pick up the phone and call someone that you haven't talked to in months. It doesn't have to be a family member, it could be a friend. And not only is that going to do some good for yourself, talking to somebody that you haven't talked to in such a long time, but you might be doing them a favor on their end by checking in with them to see how they're doing.
That's absolutely right. And what about being able to go by your grandma's house, right? Or go by your granddad's house or your parents' house, right? You can drive in proximity to their house, right? And
Correct.
still be able to see each other, right? Some families have gotten pretty creative where they're actually visiting with each other, but through the living room window, right?
Yes, exactly. Visiting them.
Part of what happens is we have strong bonding. That part of what creates our anxiety is not seeing or talking or touching and visiting, right? So that socialization is really critical to the well-being of the parents, right? Because
yes.
you know they feel your absence, right? So let me ask you this. So you were talking a bit about self-care. That's the term they use today to talk about how we take care of ourselves. You know, what are other ways besides yoga and exercising at home? What are some of the other things that are very practical, doable, right? That there's little or no cost. These are things that we can do right now that would be keeping some safe distance. So what are some of the other kind of realistic kinds of things that families are doing and can continue to do, so that this way they're benefiting physically from, you know, that activity. It also helps certainly with their emotional well-being, because as you're walking, you're reducing your stress. So what are some other things individuals can continue to do or can start to do?
Well, when I'm going to talk coming from myself, what I do, kind of like a self-care, because there's so much going on in a day-to-day. I'm kind of the lucky ones because I do get to work from home, but I have to set aside a certain space where I can actually do that work. And my son has his own space where, you know, he will have to do his schoolwork and whatever else activities he's doing. But for self-care, I like to include my son for that. Sometimes I know a lot of families are doing this. They'll play video games as a family with each other. And I think that's an activity that we weren't probably doing before COVID, because we weren't, you know, coming home and saying, oh, let's play a video game. Now that we're at home and we have that opportunity to do that. Also, gardening. I hear a lot of people like to garden, be outside, get some sun. You know, vitamin D is very important. Also, a lot of the other things that we like to do, we like to watch movies. And I like to cook with my son. If we have an opportunity, I will allow him to cook. He's 8 years old, so he's learning to cook. So I just really think it's different for everyone, but I think you really need to pay attention to what you like to do as a family and as an individual, something that you haven't done for yourself. Give yourself a facial, you know, those are things that you could do at home with no cost.
Those are really good examples, by the way. So in the absence of using technology, there's the human exchange, talking to our kids or talking
Yes.
to our loved ones. We really now have opportunities to spend quality time with each other personally, right? And so here's an opportunity to not only start to role model or express how folks can talk to each other, but to also talk to things about that are very important. The current circumstance with COVID, what impact it has on missing their friends at school, what it's like not to be able to go for cafecito with your prima because you guys get together every Friday morning before you go to work, right? So what would you say are opportunities that we can reinvigorate, that we can start to really add to the quality of our interactions and communications as Latinos?
Well, I think it's hard for Latinos to air out any difficulties that they may be having personally. You know, as a family, there could be a discussion about, preventive. And the problem is that there's a lot of loss and grief going on in Latino families. You know, the loss of graduations, the loss of birthday parties. A lot of these activities were parties for us. These were our gatherings that we, listened to our music, we ate our food, and it was an opportunity for us to do this bonding, and it got taken away so suddenly that we really didn't know what to do with ourselves. So I think that you're right. This is an opportunity for us to bond with our family that's living with us. I think more talks, more platicas like this, like maybe sharing each other's concerns and anxieties and stress will alleviate some of that mental health pressure that individuals have.
Yeah, that's a really good point. So let's pretend that we're at home and the spouses, husband and wife, are talking about something difficult. So the kids are already in bed and there they are at the kitchen table. Um, and the husband's been worried about, the situation with his job or finding a job or being able to get back to work. And so the question is, how do you see that as an opportunity for, let's say, couples to begin to have conversations that help us men, particularly men, emote and talk about challenging situations, right? Because
Mhm.
we feel stress, women feel stress. Men communicate, women communicate. So the question might be is, how do you foresee being able to give some advice or tips to how couples and parents can talk to each other during these difficult times, right? So that they can benefit from the privacy of their joint time together, but to talk about these challenges because what we know about Latinos right now is they're very worried, right? They're very worried,
Yes.
but there also exists the chance to be able to release some of that worry, right? So walk us through a little bit about how that can happen.
Yeah, I think it's important to have a conversation, and you're right. For Latino males, it's harder for them to express their anxiety and stress because they're the ones that feel that they need to support the family economically, and then the spouse is supporting the husband, whatever the case may be. So I think for her to approach him in a way that's on his level, to understand, maybe that there's resources that they can both reach out to, particularly when it comes to job resources, maybe even food resources, and maybe you don't have transportation. And there's a lot of resources in my community right now that's helping us get through this COVID pandemic. And I think a lot of Latino families feel that they don't have or maybe they don't feel that they need to reach out, that they can handle it themselves. And I think that's a lot of the times that's what we do. We don't reach out, and the male feels that he needs to handle it by himself, figure it out by himself. And then that's an additional stress and anxiety that he's bringing home to the spouse. So I think it's important, if she's going to approach him, to already have a plan in hand and to offer, some tips and resources in finding a job, some tips and resources in getting to the job, maybe some transportation resources, and maybe finding a way to also incorporate discussing next steps. What do we do if next month this is the situation? And I think it's always important to have a plan for what's next, because we really don't know what is next. But if we take care of what's primary, which is having a roof over our heads, which is having food at the table. And I think Latino families need to have that plan as well.
Sure. And actually, one of the most significant things is being able to get tested, right?
Yes,
Uh, and I've had the opportunity to get tested a couple of times. I can't tell you what relief you get from the moment you get
exactly.
your results, right? The results that we're looking for are negative, right? In other words, that we don't have that virus, because we still have to think for the time that we're waiting for the results, you know, what's happening, because we get to kind of gauge for ourselves, do we have any of the symptoms like you talked about earlier,
Mhm.
but still, right, we may be asymptomatic, right, which is another word for saying that is you may still carry a virus, but it may not, you may not be having any of the symptoms, but recognizing that testing plays an important role in releasing the tension, the anxiety, the worry, the stress. What are the things that can take place to help encourage facilitating getting tested? What are some things that parents and couples and families can do to look at that?
Well, one of the things that I did when I first started hearing about COVID was understanding what symptoms to look out for. And also, if you type in COVID testing near me in either your phone, on Google, on Facebook, a bevy of resources will pop up. And you can reach out to those resources and see what the timetable is. So let's say that you don't have any symptoms right now, you're feeling fine, but you found out a coworker has COVID. So you're concerned now. You're thinking, oh God, asymptomatic, no symptoms. I have my spouse and my 2 kids at home. Should I get tested? Well, I would say that yes, you should get tested, and find the quickest way to get tested would be to just Google it or call. Right here in El Paso, we have a number that we call, and they direct us, I believe, to the nearest testing center for us.
Well, I want to say thanks for sharing that example, because it helps people to start to see that there's opportunities for us for looking to watch for ourselves, to serve as the example for our family for how we're making sure we do things to help us protect us from the likelihood of being infected with such a serious virus. I met a woman recently who worked in a community health clinic, and she's a nurse's aide. Well, she contracted COVID, and she said she was absolutely certain that she knew that she contracted that from one of the patients who works at a local meat processing plant, where they had over 300 cases. And so she did get diagnosed, had been treated, and it was a very challenging experience for her because she's so committed as a practitioner, right? So the
Mm-hmm.
people on the front lines, and particularly Latinos who are working as nurses aides or as dental assistants or working in the field as a whole, they of course know what these risks are like. But it really speaks to how it is that our communities, right, are experiencing any number of things that might put them at risk. So, what are things that we can do to learn about what's happening in our communities so that we can take additional precautions, right? So, what would you suggest to families they do to be informed and to learn about what's happening so that they can feel that they're being able to share with their family what they know about the local circumstances and local conditions?
Sure. Yeah, I definitely recommend going to a trusted news station, or maybe on your YouTube, or whatever news that you watch. But I also recommend that you don't inundate yourself with so much information, because that could be an issue as well. Everyone needs to stay informed, and I make sure that I only watch the news at 5 or 6 o'clock, and then that's the end of it. I don't. In the beginning, yes, I'm sure everybody was on every channel trying to find out, what, oh my God, what is this? What are we in for? But now I think that we understand what we're supposed to do preventively. We just get daily updates of where our local region, where are we in terms of number of cases, are we in a wave? Are we at the peak? Have we plateaued? For us in Texas, unfortunately, we're 2 weeks behind where New York was. So now we're really high in terms of the peak of the number of cases that we have in Texas. And for El Paso, we're about 2 weeks behind where Houston was with regard to cases. So I think that kind of information, we need to be informed, also to make decisions for, do I need to go to work? Do I need to talk to my boss? Is there an option for me to work from home? Because I'm really concerned about what's going on with the number of COVID cases in my region. And then also making decisions for our kids to understand because they hear the news, some tend to know more than we do sometimes. And so we need to inform them and stay calm and focused, and let them know that they're part of the preventive effort for the family as well.
You shared something that's particularly uh, significant around kids. So for families that have school-age children, right? they have a different set of circumstances. They now suddenly find themselves doing what?
Teaching.
Uh, yeah, being the teacher, the teacher's aide, having to get instructions, and all of this is coming in through all these new methods for OneDrives and e-documents, all these fancy things for
Yes.
how
Yes.
information is exchanged. So say something about what that's like, given, let's say,
Yeah.
for instance, your own son, right?
Hmm.
And how all of that's transpiring, because children that age today are very different from when I was that age, right?
Oh,
um,
yes,
Back
definitely.
then, I don't think they even made uh, uh, they didn't. I think I was born in the era when black and white TVs were
Yeah.
popular. But anyway, so what are some of the things that parents and their school age children are having to deal with and talk about when it relates to school?
Yeah, that's a really, really good question. And I'm glad you asked it because I'm sure there's a lot of people in our audience who are trying to decide. I mean, there's so many mixed messages coming from our state and federal government, and it's hard to make a decision for our children when we're also anxious and afraid to go to work and not contract the virus. I think for me though, every decision is going to be based on what the family can do. And I think one of the primary things that is worried a lot of parents is childcare. I mean, our kids, there's a lot of single parents who still have to go to work and may not have the luxury of having grandparents who are home where the child can go while the parent is working. So I think a lot for me is what's most important is that childcare. And also, if you're going to be homeschooling, a lot of our kids are going to be homeschooled by grandparents if the parents are going to work, if they're essential workers. So what does that say for technology? How is that going to work when grandparents aren't used to using a computer or a laptop or logging into all of these different sites and uploading all of these assignments? I have a PhD and I cannot tell you that I am a pro at block math. I don't know why they came up with block math. That is a new math for kids in
Right.
second and third grade. So my son and I, when he went on spring break and didn't get to go back, it was a challenge trying to log in. And if you have younger kids, you have to sit with them. It's not like you can sit them in front of the laptop or sit them in front of the computer and go about your day, or tell grandma or grandpa, okay, I've got to go to work, here's where you log in, see you later. I mean, that's the kind of thing where parents are really going to have to make decisions based on their life and what work entails for them, and it's a difficult decision, and I'm not having fun making it, because I'm going back and forth. But I really feel like for me and my situation, I'm going to be homeschooling and doing it online for the first 9 weeks for sure.
Oh, got it. That's right. Because every school district or different states are kind of making critical decisions right now about how returning back to school is going to take place. And but you're very clear to describe that whatever those challenges are, it's challenging for anyone, right?
Mm-hmm.
So the question is here for you is envision that in 3 months from now that the messaging or the Latino community is starting to get more and more informed about COVID, because what we're seeing today are increases in the number of infections, right? And so part of what we've heard people describe is the flattening of the curve. So that means that while there are bigger forces at play about how that happens within families, right? How can we within our own families flatten the curve, right? How is it that we as a family unit can start to come around this circumstance? Because what we know about Latinos is how much we value our families, how important it is to us to protect our families, and how important it is for us to provide for our families. So knowing all of that, how is it that then we can encourage Latino families to then flatten their own curve? See what I'm saying?
Yes.
So yeah,
So,
there's a society around us, there's
yes.
systems, and there's all this around us. But how can we, as a family,
Hmm.
flatten our own curve?
So let me tell you from personal experience, I had to wrangle in my mother, who's a social butterfly. And it was very difficult for her to understand because she was very connected to her church. Her church and her faith is what kept her going through these times and through other difficult times. So I had to make her understand the seriousness of the virus and the preventive measures that we had to take as a family. And if for some reason we felt that somebody was going to come over, I would warn her, okay, if you have somebody that's going to come over, realize that for 14 days, we will not be able to come visit you because of the fact that, you know, asymptomatic and preventive measures, like I mentioned, is wearing your mask, washing your hands, watching your distance, and watching your symptoms and symptoms of others. So I think it's important for Latino families to flatten their own curve, to have a plan, as I mentioned, to have those preventive measures, to understand the guidelines within their own family. Like I mentioned, there may be 3 generations living in one household. So if there's an essential worker that's going to be coming into the household, how do you handle that? If they're working in a hospital, if they're working in a meat packing industry, if they're working agriculturally, what do you do prior to coming into the home so that you don't have that chance of infecting another family member or the children or your elderly parent? Because you can have 3 generations living in a household at one time. And I think it's important for them to understand the only way that's going to be helpful for the family is to follow rules and guidelines within your own daily life in preventing contracting COVID.
That's a really good point. So let's talk about community resources for a little bit.
Sure.
So you touched on it earlier about in, getting information about transportation, about food services, utility assistance, unemployment insurance, because these are resources that are currently available in most communities. So how would you foresee families being able to get information about those kinds of resources? So let's pretend, for instance, that I have a cell phone, and the question would be is that the cell phones, particularly for Latinos, are very popular. So that means not only do the grandparents have a flip phone, the parents have a smartphone, and the kids have these very sophisticated little devices, right? And it's the little kids teaching the parents and the grandparents how to use it, right? But what we know is they all have access to this technology, right? Because we worry about our kids. What do? We text them, right? So what can we learn about what resources are available through these devices so that this way we can work to access them, right? Because we should benefit from those resources because it's a way of helping our families, right? Providing and
Yes.
protecting for our families includes community resources, including our personal and our family resources, right? Because we're doing all of the above, right? We're very creative. We know how to look at different types of ways of resourcing ourselves. So, what are some things you would say about community resources that would be helpful for families in these current circumstances?
So sometimes some of the resources that I hear about are through the local news. So then I'll Google them or I'll put it I'll type it into Facebook, like local resources, and always type in near me, because what that does is identifies your location. And so it's always going to pop up your regional services, whatever those services may be. You could also type in COVID transportation resources. You could type in COVID food resources. One of the local community nonprofits here did a wonderful thing by doing a community refrigerator. And what they did is they put in cold sandwiches, fruits, and water into this community refrigerator so that anyone who required food for that day could come in and take whatever they needed. And then they just asked that they could replace it at some other time when they could help out. So I know that it's important. Also, our kids are really linked to social media. And my son, he's very inquisitive and he understands all that's going on with COVID. So if something pops up that says, you know, it's COVID related, or he sees a statistic that he thinks might be important for me to see, and he'll bring it to me. So that's how you incorporate kids into the conversation, and they learn as well. You can even extrapolate from whatever he brings to you or they bring to you and have a discussion about what's going on. But we're
Oh, that's
lucky
great.
here. We're lucky here in El Paso. We have a lot of nonprofit Hispanic community nonprofit foundations that have stepped up to the plate during this COVID pandemic. And you just Google nonprofit COVID resources and they pop right up. There's a list also. You can go to your city website and they might have a list for COVID resources. And I also would recommend your job. There might be peer support services and you might learn about some of the local resources through your peers at work.
That's right. Yeah, your coworkers.
Co-workers.
Let me do a little shout out here real quick if I can, Susie. I
Sure.
want to give a shout out to Gary and Tomasita and Rachel who have stayed watching, and we have viewers who are coming in as part of, when you're scrolling to your device, right? They
Yes.
look to see what images they see live Facebook, and then they listen for a little bit. But if you can, for their benefit, tell us the 4 Ws again, because I think that's a nice little way to capture something that is very useful, because part of what we want to do is be able to message and communicate with the Latino community that what they're doing is important, and we want to encourage more of that, but we want to make sure we say it in a way that people can understand it, right? So can you say those 4 Ws again?
Sure. The first one is wear your mask, which we all know we need to be doing. The second one is to wash your hands. The third one is watch your distance instead of social distancing, because by human nature, we all need to be social. And number 4 is to watch your symptoms and watch the symptoms of your friends and family as well.
Very cool. So yeah, so that makes a lot of sense, because words have meaning, as they say, right? And so it's nice to be able to say things in a way. Yeah, we can kind of relate to that. So let's talk a little bit about extroverts and introverts. Those are fancy words for describing those folks who are kind of uh, extroverts. They're very social, very sociable, right?
Mm-hmm.
They're very engaging with people. They like to be connected with people. They're out in the community. They're very involved in ways that they want to personally be engaged with others, right? The introverts are different, right? They have a different method, a different style, and while they may keep to themselves, they're very comfortable in that space, and they're very functional. So part of what happens is those two individuals are experiencing different circumstances now, right? So in any family, there are introverts and extroverts, right? So what is it that's happening to the extroverts that you've been hearing, right? There's that family member in the Latino family who's, man, they know everybody in town, right? They know all the resources and they tell the family all about it. But guess what? Some of that's been impacted now, right? But what's
Mm-hmm.
happening to the extroverts themselves personally? What do you see happening with Latinos who have always been the kind of the communicators, the cultural brokers, the ones who are out in the community? What's happening to them that you can give some advice or tips about?
Yeah, if you're an extrovert, which I have both in my family, I have extroverts and introverts. I think for the extrovert, it was definitely harder to understand what this physical distancing meant and what it meant in terms of not contracting COVID. So I think for them, they had to find a way, other ways of being social and other ways of participating with their community. Like I mentioned earlier, my mom participates in her church with the sermons on Sundays via her iPad. She also connects with a lot of her family and friends and church members via the telephone. There's still, there's still ways to stay connected to your community. I saw online that there's ways to stay connected as a volunteer. You can volunteer online as well and help out many of the community services that require your expertise. You may be an expert in something that they need just to facilitate a webinar like today. You may have some information, some important information for Latino families that they can share during this pandemic. So yes, they had to change their way of thinking, but there's opportunity here. And I think also we haven't really mentioned reaching out like for services. As I mentioned, self-check-in, mental health services and mental health professionals really did a nice job of pivoting from face-to-face, in-person counseling, in-person check-ins to now the telehealth services. And I think that's important to mention because those telehealth services are available in the comfort of your home. And so this mental health stigma, we're overcoming by having and these telehealth services available, not only to the Latino communities, but to everyone.
Yeah, well, thank you for sharing that. That's particularly important because uh, one thing that we like is our privacy, right? Latinos are very, they take privacy very important, as a very important
Yes.
issue for them, right? So when you said the privacy of their homes, it kind of plays into a couple of things, right? Folks who are, staying home for, any number of reasons, independent of COVID, right? They prefer doing things from home. So in this case, if telehealth is available for folks, and telehealth is that fancy word for saying you can use telecommunication devices for getting information or services about your health and your well-being, right? So if I need to call for an appointment, which I can do with my cell phone, then I can make an appointment and they can get me that information so I could actually, on my own cell phone, actually speak with my doctor on my phone, right? And they can actually even walk you through how to do that. And so telehealth is particularly important because at some point when we do need to reach out for help, right, that we can do that, with, particularly with the community health centers or with Catholic charities or with the local free medical clinic and or the local community-based organizations, right? So telehealth is starting to create opportunities. And so what more would you encourage families to think about when in using their devices? Keep the privacy at their home by not having to be out in the community or at the clinics, but they can still reach out to get services, right? So what are some tips parents can take into consideration for reaching out with telehealth services?
Yeah, I would like reach out to your medical provider and see if they offer that telehealth service. And if it's not necessary to do a face to face, then you can set that up. I mean, I know that my mom, some of her appointments are set up as well. And my father, he also does telehealth services. So it's really easy for them, and they find it's convenient because they don't have to get out of the house and they don't have to, put themselves in any kind of danger to contract COVID if you're going into a medical clinic or a health center.
Well, I really appreciate you bringing that up, by the way, because I think it really talks loudly about our listening audience. And so I've been seeing on our Facebook that people are giving their likes and their hearts and their loves for this information. So what that tells me is folks are appreciative, right? And I greatly appreciate your having taken the time today to share with us. But we do know that the more messaging, the more information we share, the better, right? Because
Yes.
in my work with the National Latino Behavioral Association, the one thing I've heard pretty consistently across the country is Latinos want and need more information, and they greatly appreciate education. And it says something really about who our communities are, and it's the fact that we're really good listeners, and we are very astute at observing. And so we learn from all of these things, right? We may not have to have a zillion questions, right? But if we were to do this again, I want you to, before we wrap up today's platica, is just impart any final comments, any wisdom, any insights, things that you still haven't had a chance to cover that you'd like to touch on, because it's a great opportunity for you to share with the Facebook audience things that are positive, reinforcing, help really keep things in an optimistic, hopeful way. Because, como dice el dicho, right? There's a dicho that says, I'll say it in English and Spanish, by the way, so whoever's listening in English will get to hear what the translation is. So, dicho es que la esperanza es la última para morir. Hope is the last to die. And
Mhm.
so there is such hope in all that we do, taking care of our families, really ensuring that what we're doing is taking care of ourselves. And so, what are some of the important messaging that you'd like to leave us with as we get ready to close up our platica?
Sure. Thanks, Fred. First, thank you for having me here today. It really was nice to have this conversation with you and to share some of the information and experiences that I've had going through this COVID pandemic. One thing I want to leave people with is that there's no health without mental health. I think it's very important to have yourself check in and your family check in on a daily basis to see how you're dealing with all of the issues pandemic. And also one of the recommendations that I made during our discussion was to call somebody. Really do pick up the phone or text somebody that you haven't talked to in a long time and reach out to them and see how they're doing. Because we're all going to get through this together. At some point, we're forging together through this pandemic. And one of the things that I'm concerned about is our second wave, which is that mental health wave, the consequences of COVID, which is that mental health aspect. And we really need to strive and be strong for each other, which we do as Latinos. And I hope that they're empowered now to make some decisions for their family, to understand some of the things that they need to do for themselves, and to reach out if they do need help, because there are mental health professionals available at no cost or a discounted cost. So please don't feel that there's going to be so much money involved that you can't reach out for help. So we are there, and I hope that this information touched somebody's life today and made a difference. So thank you for having me, Fred. I really appreciate it.
Oh, absolutely. One of our colleagues, and I'll share her first name, did share some comments on Facebook, and she herself is a therapist, and she wanted to acknowledge how telehealth is helpful. In fact, I like the way she said it. She says she does do mental health therapy, and with her clients, and she said that they do benefit and make things much more easily accessible.
Definitely.
That's really, really so important because what we know is Latinos of any of the groups in the United States have had the least access to services. But when services are needed, what Ada is reminding us is that she and her own local community is making her practice available to use telehealth. And the convenience of that is incredible, right? So that means you don't have to take the bus, or you don't have to drive there if you don't have a car. You don't have to kind of coordinate carpooling with your primo to come pick you up at a certain
Yes.
time.
Yeah.
And then he shows up 20 minutes late, and then you get to your appointment late, right? So what's happening is what I'm hearing is the encouragement to be able to reach out. And another colleague who's been in the field for a number of years, he's a counselor himself, and his comments were he really thinks it's important to continue to have cultural sensitivity for the work that we do for Latinos, and he's absolutely right. Latinos really like to talk about their life circumstances. They really do, right?
Yes.
Raza are the best storytellers, right?
Yes.
We can tell our story better than anyone. But that's the point, right? Is that
Mm-hmm.
nos vamos a despedir del dolor, right? We're going to release the pain. And that's really the whole purpose of reaching out for help, is to release the pain so we can start to sort through how we're going to manage and cope with life circumstances.
Correct.
Because in fact, we have different layers of things that are infecting Latino families. But what we're really attempting to do is to communicate and encourage with folks how they can continue to outreach. So this is what NALBO is planning to do over the next additional 4 months. Is we're going to be inviting professional cohort, some professional who's got familiarity with Latino communities, who's public health, a behavioral health, a medical doctor, people who can offer medical expertise in a very factual way that's easy to understand, right? So what's important is for people to be able to communicate in a way that people can say, qué buen consejos me dio esa mujer. What good
Yeah.
advice that lady gave me.
Mm-hmm.
Because the advice was important because we recognize that taking care of our families is preeminent, and not
That's
just
number
our
one.
family,
Yes.
yeah, and ourselves, right? So we're going to continue to do some of this messaging and education, if you will, over the next few months. And so today you got to kick us off in that regard, Susie, and it's
Thank
just
you
been
so much for having me.
it's been a real delight. And so I guess we should say our despedidas, right? Our farewells for
Yes.
now. We'll get to, you and I will continue to get to work in a number of different ways, but I want to say thank you for making such effort to impart your experience, right, as a doctor, right? So today I may have referred to you as Susie and Dr. Villalobos because That's interchangeable, right? In a way that I think helps people recognize that we can talk to professionals respectfully, but in a way that's personable, right? Um, because before the Affordable Care Act was passed, one of the things that was given as testimony at one of the committees was that Latinos were having a hard time talking to their doctors.
Mm.
And that meant two things: talking to them about a medical situation, and then the other is talking because guess what? They were more fluent in Spanish than English.
Spanish, yes.
So you put the two things together, it made it very difficult and challenging. So today, while we did today's program in English, we'll be doing a couple of these programs in Spanish.
Spanish.
So the point being is that we're going to pay attention to the fact that the Latino community is very much wanting information and education. And please share with your friends and your colleagues a little bit about today's show. And for the folks who did get to listen in part or who have stayed listening in, we want to thank them for taking the time to join us today. And with that, we're going to say mil gracias
Adios.
to
Yes.
everybody and to you, Dr. Villalobos. Greatly appreciate your time.
Thank
And
you.
for those of you who need information, you can feel free to contact our organization and we can help look to find some resources for you if your family needs some support. And the way you can do that is I'm going to say this a couple of times, and then I'm going to ask my colleague Victor to type our website on Facebook page so that this way, if folks want to find us that way, that'd be a accessible way, and they can reach us at, and I'll say this twice, by the way, www.nlbha.org. I'll repeat it one more time. www.nlbha.org. And we look forward to hearing from you. And I greatly appreciate all of you who were able to take part of your afternoon to be with us today. Dr. Villalobos, the best to you. And
Thank
we're
you,
going to go ahead
Fred.
and sign off.
Yes.
Saludos. Thanks so much.
Bye, everyone.
Bye.